Nuffield's the largest trading charity in the UK, probably the largest healthcare social enterprise in the UK. We've been in existence for 50 years and we've evolved over a period of time. We're now the only organisation that provides joined up from prevention to the treatment of ill health through diagnosis, joined up health services, which we think is health as it should be. Our goal is to create a seamless approach so that when you're trying to look good, trying to stay well, trying to manage the risks that your lifestyle engenders, we're there to support you. And then when you need the answer to something that's bothering you in terms of your health, we can provide that. And then if you want something fixing, we're there for that for you as well.
Do you think that we've grown up enough in this country? Are we mature enough to realise that we do need to look after ourselves and preventative health is better than cure?
That's a very interesting question, because I don't think we should be putting the onus solely on the health consumer there. There is a health consumer out there that is very active and very engaged in looking after their health. I think there are more people in that arena than we envisage. The growth in health services, particularly the prevention side, outside of the NHS has been phenomenal over the past few years. And I think one of the problems, and I think your question indicates this, is because of the NHS, we typically think of healthcare in the UK as fixing problems. And you could argue that the NHS, the medical model that predominates healthcare thinking in the UK, has disenfranchised the health consumer. There's a health consumer out there, they want to get more involved, they want to get more engaged. And there are very few organisations out there providing them with the tools to do that, which is why Nuffield is so important.
How is Nuffield going to make it easy then for the consumer to become engaged?
Well, first of all, the consumer has to want to be engaged. And I think therein lies some of the policy pitfalls in current health thinking. There's no point in being punitive about not being engaged. There's no point in giving incentives to try and engage. Because either way, if you're doing that, you're the one that's motivated and not the health consumer. So it's about creating a culture of engagement. In order to create a culture of engagement, you've got to take away the issues that disempower the health consumer to become engaged. And some of that's providing them with the right tools and the right environment, and understanding what's good for them, because everybody's different. Everybody has a different approach to change their behaviour in relation to lifestyle, and addressing that.
And of course, what's so wonderful about it is it feels very different from the nanny state.
Oh, that's slightly pejorative, and I don't want to go there too much, but let's just explore that a bit more, because a lot of people keep urging the NHS to get into prevention. When you actually examine that, it does become somewhat frightening, because prevention relates to lifestyle. It relates to a myriad of small decisions that you make on an everyday basis. I don't think we want the state involved in that area whatsoever. And therein lies one of the fundamental issues that I think we have with NHS policy. In fact, with health policy in the UK. Sometimes I wonder if we actually have a Secretary of State for Health. I think maybe we have a Secretary of State for the NHS that doesn't consider the broader health aspects across the whole of the UK and doesn't think about the health consumer out there. So we've got 1 in 5 households out there who have a chronic disease, of which 1 in 3 have multiple chronic disease problems. You've got the World Economics Forum saying that chronic diseases are the third greatest risk to global economic security. It's quite worrying when you think about where we are at the moment in terms of global economic security. You recently had the York Health Economics Forum talking about the growing problem and cost of diabetes. 17 billion, it could bankrupt the NHS. All of this brings us back to the debate about preventative health. And when you start to think about it, we don't really want the state to intervene on our individual lifestyle decisions. Chronic diseases and preventative health are all linked to that. So the real answers to health problems and challenges in the UK lay outside of the NHS. And that's where I think the NHS social care, health and social care bill is flawed. What's happened in the past is the policy to attract the private sector to help the NHS may have actually attracted the wrong sort of investment. And I think that in itself may have spilled over into the debate about public sector good, private sector bad. Because typically we have private equity style investment that's only there for the short term, that has a very highly leveraged model, and I think that gives the whole of the private healthcare business really the wrong reputation. Whereas organisations such as Nuffield, not-for-profit organisations that are there for the public benefit, that reinvest all of their proceeds back to improving services, improving quality, are the right type of investment. And I think we need more of that in terms of the private sector involvement in the UK and less of the wrong type of investment.
And as a final question, can you just paint a picture, a vision of the future, a specific example where you think the private healthcare side will work very well with the NHS?
I don't think we should talk about private working well with the NHS. I think, what's the private sector's contribution to the health challenges for the UK? And I think the big contribution the private sector can make, whether they're healthcare providers or just employers, is to actually do more to look after the well-being of their workforce. I think that's the new corporate social responsibility agenda for the future, and that's where most employers should be focusing their attention.